Now look at this challenging case. The patient is having nystagmus, and nystagmus increases when the target is distant, and the nystagmus dampens on convergence. The nystagmus is horizontal, and now also in the right gaze here the nystagmus almost diminishes. So it is the null zone or the null point is in the right gaze. Now again you can see that the amplitude and frequency of nystagmus increases in the left gaze. So that the viewers diagnosed this case correctly as a case of congenital nystagmus, or correctly called idiopathic infantile nystagmus. It is bilateral, symmetric, conjugate, rhythmic, involuntary eye movements. Look at the signs. Eye movements are horizontal and remain so during vertical gaze. So basically horizontal uniplanar nystagmus. Congenital nystagmus may be pendular or jerk in nature. Here it is jerk. Whenever there is a jerk nystagmus, you have to look for the fast and slow components, and you name it along the fast component. Like here the fast component is towards the left, so it is left jerk nystagmus. Usually congenital nystagmus patients have good vision. In a sensory congenital nystagmus there is a poor vision, but in a congenital motor nystagmus like this patient has got 6/12 vision both eyes. Another feature, oscillopsia. There is no oscillopsia. Oscillopsia means when the patient's visual field or vision is shaky like earthquake. Oscillopsia is a feature of acquired nystagmus. So even in adulthood, in congenital nystagmus, there is no oscillopsia. Intensity of nystagmus decreases in sleep and upon convergence, and also nystagmus disappears or dampens in a null position. Here the null position is in the right gaze. So the position where amplitude and frequency is decreased or almost negligible and the vision is maximum, that is called the null zone or null point. So infantile nystagmus has null point 2, and you can bring the null point in primary position to decrease its amplitude, frequency, and to straighten the compensatory head posture. That is the hallmark of idiopathic infantile nystagmus. So that was all about the congenital nystagmus, infantile, idiopathic nystagmus, and I hope after watching this video you will be remember the signs and diagnose it easily. Thank you very much.